Hello, I'm Dr. Bhaskar Mukherjee, consultant ophthalmologist, and I'm also a life member of Glaucoma Society of India. Today, I will speak on glaucoma. Now, there are various kinds of glaucoma present in the community. The most important are primary open-angle glaucoma and angle closure glaucoma. Now, India, it was predicted way back in 2014 that in 2020, India will carry about 20% of the world's glaucoma population, which has happened. People who are suffering from diabetes, hypertension, people who have eye trauma, history of eye trauma, they can suffer from glaucoma. Now, apart from the various types of glaucoma, I'm going to discuss about primary open angle and primary angle closure glaucoma. In primary open angle, what happens is that the angle remains open, but the production of the fluid, that is aqueous humor inside the eye, it is more than normal. That causes increase of pressure by which the optic nerve gets damaged and leads to blindness. In primary angle closure, the amount of aqueous humor produced from the ciliary body, that is of normal volume, but the angle here, that is the iridocorneal angle, where the iris touches the cornea, over 180 degree, down 180 degree, that gets opposed or closed. That leads to angle closure glaucoma. The treatment of angle closure glaucoma primarily is making a hole here with laser. We call it YAG laser peripheral iridectomy, by which the aqueous humor that gets drained from this portion and also through that hole, and gets drained up in upper iridocorneal angle and also in the lower iridocorneal angle. So that is the primary treatment. Apart from that, we have various medicines available nowadays in the market, which decreases the aqueous production and aqueous formation, also enhances the drainage procedure, and thereby the aqueous humor pressure inside the eye decreases, by which we can keep this optic nerve end healthy and the patient's vision gets restored. But glaucoma can be a genetic disease. People suffering from glaucoma in the family, the later progeny, they can suffer from glaucoma. So a regular eye checkup is necessary, particularly 6 to 8 monthly eye checkup is necessary. And glaucoma patients often forget to give eye drops. We call them defaulter. That is a dangerous thing, because if you have glaucoma, you have to give your eye drops regularly, get your eye checkup regularly, do the field test, and most important is that you must not suffer from chronic constipation or chronic cough. That increases the percentage of glaucoma, the risk of glaucoma. And you must not do any head bending exercise. Pranayam, in my own experience, I have seen people doing pranayam, the IOP, the intraocular pressure rises, and that can enhance glaucoma. And you must not do any asana or any posture where the head is going down below the chest level. And of course, the most important thing is that get yourself checked with your ophthalmologist regularly. And if we find that the vision is going down and the field is deteriorating day by day, then we opt for glaucoma surgery, which is trabeculectomy with mitomycin C or any other antimetabolites. So, and later on, if that also fails, we can go for minimal invasive glaucoma surgery, where a stent is implanted inside the eye. That is the latest procedure which is going on in India. So that's all about, more or less, about glaucoma. If you have glaucoma, get yourself eye checked regularly.